Welcome back to Freedom Chiropractic and Rehab. We're here doing some hip mobility today. All right, so Dr. Chip is with a patient right now, so he doesn't know we sold a camera. All right, so it's just Nicole and I. We're gonna do some hip mobility. We're working on the hip flexors today. The reason why, we've had a lot of patients come to us with lower back pain, and a lot of it has to do with our hip flexors not being mobile. So if our hip flexors are pulling us forward into this position, then our back has to try to compensate with flexion, okay? So it's using our spinal erectors to try to get back into our good posture, but really good posture is being able to fully extend our hips. So we're gonna teach you, and this is a two-part thing, so it's not just stretching. A piece to mobility is rolling out. We need to smash the hip flexors, so we're gonna show you right now what that looks like. Two different ways. The first one is with a foam roller. So as you see, Nicole is going to be rolling through that hip flexor. So she's going to start on the outside here. She's going to work towards the middle, all right? So spend a good amount of time, maybe 30 seconds on the outside of the hip flexor. See how she's angling all of her weight on there? Then she's going to spend a good amount of time in the middle of her hip flexor as she brings her body towards the middle here. All right, so wherever those tender spots are, spend a little extra time there. The second way, for some of you, you've done that before, you're not getting enough out of it, the lacrosse ball is going to be your friend here. So the lacrosse ball is good because you can target specific places. The hip flexor is not huge, it's not your quad, right? So because it's small, the lacrosse ball is perfect. Some of you can just jump straight to it, and that's cool too. So what you're going to do is you're, again, going to start on the outside here, okay? So the lacrosse ball can get a little tricky. It might be sliding around or whatever. Applying pressure in one place will be sufficient, okay? And instead, what you would do is start to just maneuver your leg rather than trying to roll around it, okay? So she would do what would be like a hamstring curl and try to get her hip into flexion by squeezing her glute, okay? And then she can roll around. That's fine too. Staying in one spot that's feeling a little tender, that will be sufficient for this, okay? So spending a good amount of time. When you do this, you want to think about 90 seconds to 2 minutes when you do it. So that's going to break up some of the tissue that's tight, which is a piece of this. The second piece is going to be lengthening that muscle. So what that's going to look like, we're going to show you two variations. Well, three variations. The first one, Nicole's going to use this little mat for her knee, so make sure you're doing it on a soft surface so you don't hurt your knee. So when she does this, she's going to do, my version of this is to try to lengthen the hip flexor as much as possible. So what she's going to do is she's going to bring her foot out in front of her just a little bit, and then she's going to push into her hip. Notice when she pushes into her hip, she's not flaring her rib cage. Okay, so show us what a flared rib cage looks like. Yep, so her rib cage is popping out, and that's gonna cause her to have that same bad posture, okay? So she comes forward, she's gonna squeeze her glute really hard and take a big deep inhale and exhale, try to get a little bit further with each breath, okay? If you need to pulsate back and forth, that's cool too. The second variation of this is she's going to bring her leg into a 90-degree angle. Okay, so see her leg's not as far out here. She's going to tuck her pelvic bone down. Okay, so she's really squeezing her abs super tight, and then she's just going to come forward. She's not going to come forward as much because she's not going to be able to, but that's going to bring up that stretch a little bit higher in the hip. All right, both of those are great. If you can do both, even better. The third variation of this is going to be if you need a little extra, all right? So start with the first two. If you didn't get enough out of it, this is gonna be your best bet here. So the band works, your hand will work too. When you go into this, again, trying to squeeze your glute, right? We're not trying to stretch the quad. If it feels like it's stretching your quad too much, you're not squeezing your glute enough, or you don't have the mobility to do this one yet. So work on the first two. But if you can, she's going to squeeze her glute super hard, and again, she can even bring this foot forward a little bit and then lean into that stretch to get a little bit extra on that hip flexor. So thanks for coming here for Freedom Chiropractic and Rehab. If you can, hit the like button and the follow button. See you next time.
What's going on out here?